It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox back with Candace Kruger, and welcome back to another edition of the Best Docs Network, which of course features some of the best doctors in the entire Dallas-Fort Worth area that Candace helped change people's lives.
You're absolutely right. Like our first doctor, OB-GYN, Dr. Patrick Allen. My two young children and my husband and I were in Disney World, and we had had a great time for a few days in Disney. The last day of our trip, we went into the hotel room, laid down, exhausted, and I ran my hand across the top of my tank top and felt a lump in my left breast. Returning to DFW, I went in to see Dr. Allen, who then sent me for a mammogram.
And I think it's important that for patients, if they feel a breast mass, that they get in, have it evaluated. Sometimes that's imaging studies, sometimes that's ultrasound, sometimes that might be an MRI. Some of these are benign things that maybe it's a cyst that needs to be drained, so maybe it's a little fibroadenoma that just needs to be watched, but sometimes they'll be breast cancers.
When I saw Dr. Allen, he sent me for a mammogram and an ultrasound just to get a better look at the lump. After the mammogram and the ultrasound, I got the results in the mail saying that it wasn't anything to worry about. They felt like that it was a fibroid adenoma, and to come back for another mammogram in a year. And at that point, Dr. Allen, I feel like, changed my life because he didn't accept that. And he went ahead and sent me to a breast surgeon just to make sure.
And I want the breast surgeon to make a decision on the patient. I want them to decide. They're the ones that usually have the experience to say, I can watch this, I need to biopsy this. And a lot of times they go over these risks and benefits with the patient as well, and they'll be able to give them some guidance on which way to go.
After going to the breast surgeon, she said she felt like it was a fibroadenoma, but because of the size of the tumor, she wanted to go ahead and take it out. When she took it out, that's when we found out that it was a very aggressive form of breast cancer. I was only 34 when I initially found it. I was staged at a 2A, so it was relatively early. But because Dr. Allen pushed and didn't just stop with the results of the mammogram, I feel like he saved my life.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And they slowly got worse and worse and worse. And then of course I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
My reflux was getting progressively worse to the point to where I was getting reflux from drinking a glass of water. And I'd gone to a gastro guy before, and he had told me, oh no, that's at least 5 to 10 years down the road. And then the next week I saw Dr. Ihde's piece on the news, and I gave him a call and said, hey, let's do something about this.
When patients come in and they have a variety of symptoms, some of which may be reflux and some of which may be other disorders, there are a lot of different tests that we can do. Upper endoscopy, pH study, manometry, a new study called impedance, upper GI study, which is an X-ray study, and also even looking at the gallbladder to see whether that's working. We have all those different tools to help us tell, is this reflux, is it something else, or are there two things going on? And to be able to get the right evaluation is very important, because if you don't have the right diagnosis, obviously the treatment's not going to work.
We did the endoscopy and took a look, and he said, yeah, you're a candidate for it. He explained to me that I had GERD, which is gastric esophageal reflux disease. And the procedure would be called a TIF procedure, transoral incisionless fundoplication.
When patients come into the office, we will sit down and discuss their symptoms. And we'll evaluate both their symptoms, we'll suggest a workup, then we'll decide whether they're a candidate for the surgery or whether they should have further evaluations to rule out some of the other conditions that can contribute to reflux.
I remember the first appointment prior to having the procedure, he had a dry board, and he drew his drawings and explained what was going to happen during the procedure, what was going on in my body. Dr. Ihde explains everything. A, B, C, all the way down to the Z. He explains it all, and he's very methodic, and he's open to any questions you want. He gets the job done. He's great, got a great bedside manner. Now I was able to enjoy life again.
Well, winter is here and hypothermia can occur, especially if it gets real cold or if you're up in the mountains skiing where a lot of hypothermia occurs. So what is hypothermia? Well, obviously it's when your body temperature goes down because you're exposed too much to the cold. Your hands may go numb, they may turn colors. You don't want to get gangrene, that's when the cold causes damage to the blood vessels so that no blood gets to the ends of the fingertips or the toes, and they'll turn black or blue, and you can lose digits that way. Now, hypothermia also can cause mental problems. This is where you don't think properly, and that's the dangerous part about hypothermia, is as you get colder and colder, you think less and less about how cold you're getting, and you make inadequate decisions about staying warm. This can result in a potential problem that causes hypothermia to result in heart problems, finger problems, gangrene, all kinds of issues. So when it is cold outside, you've got to plan ahead, keep warm, use your gloves, and plan on the worst in case the weather gets bad.
When patients come in to see me to talk about pain management, one of the first things we're going to talk about is how are they managing their pain. If they're in pain, then they're not going to have a good quality of life. That's why I became a pain management physician, return patients to a better quality of life and give them pain freedom. The first treatment process, it really is just listening and then educating and then physical exam. Oftentimes we're taking some x-rays to make sure how much arthritis a patient may have, if they had any previous fractures. And sometimes, especially with the back or the neck, they may have had a fracture and we're never told. Then we'll talk about if we need to do any more further imaging, some more complex imaging, or if we have to do any electrical studies to find out if they have any nerve damage. We'll talk about if they have any instability, and then we'll talk about how we correct and treat that. There's so many medications, it just runs the gamut. There are over-the-counter anti-inflammatories, which are fine. There are prescribed anti-inflammatories, mild narcotics, heavier narcotics, neuromodulating medications or medications that decrease the irritability of nerves, different medications that are transdermal, they go through the skin, that can help out with some of their pain as well. So it's sort of a rainbow of different medications that we can give. Oftentimes, patients will be taking medications and they can become frustrated with that, and they're looking for something that lasts longer, and that's when we start talking about doing injections for them, epidural injections, nerve blocks, facet injections, and that can help out with decreasing their pain for a longer period of time. While somewhat more invasive, it's still very, very safe, very fast to do, and can give up to weeks to months of relief. Our ultimate goal is to give people pain freedom to go out about and do their normal activities and really enjoy life again.
Roger had a traumatic spine injury that kept him from walking until he met Dr. Rebecca Stachniak. To find out more about Roger's story and other life-changing stories, log on to bestdocsnetwork.com.
Yeah, we tend to think of athletes as being healthy people. They're out running or lifting weights or wrestling or whatever they do. But surprisingly, there are a number of conditions that are more prone to develop in athletes, depending on what kind of sport they engage in. One of the reasons is they may be in an environment where they're very close to other people that may be carrying a bacterium, for example, like staph, so they're prone to get boils and sometimes cellulitis and folliculitis. So that's one thing that can happen. There's also sometimes herpes virus infections, especially in wrestlers. There's a type of herpes called herpes gladiatorum, which is due to their touching one another in a wrestling match, and one spreads the herpes to another one. Fungal infections too. They get hot, sweaty. The skin, especially in runners or people that are in hot, warm environments, the skin chafes, and then fungus can set up shop there. They can get a yeast infection or can get the so-called jock itch, which is due to ringworm type of fungi. So those are all things that we see fairly commonly in athletes. Yeah, athletes can protect themselves if they use careful skin hygiene. So in other words, for wrestlers, for example, they need to make sure that they use a good antibacterial type of wash very frequently, especially after they've wrestled and ideally before they wrestle. So if the wrestlers are all doing this together and they're keeping the gym clean and all this kind of stuff, the chance of spreading those kind of infections is certainly less. As far as trying to prevent things like ringworm, it's good when you're getting hot and sweaty to let that area kind of cool down. Take a cool shower, let the area air dry so that it doesn't really just stay hot and macerated and whatnot. You think you might have one of these infections, athlete's foot or jock itch or whatever. Probably the first thing you can do is maybe just try something over the counter. There are things like antifungal preparations that you can buy at the pharmacy. If it's not getting better within about a week or so, probably ought to call it to the attention of your dermatologist, have them take a look at it. They can do a scraping or possibly even a skin biopsy. Even though in a young individual that's got the predisposing factors, that's going to be by far the most common cause. There are some other things sometimes that can look like fungal infections that are more serious. So you wouldn't want to let it go too long if it didn't respond pretty quickly to treatment.
And don't forget, for more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
Right now, the place to go is our next doctor. It is podiatrist from PAMA, is Dr. Ed Singleton.
A bunion is a bony deformity, a structural bony deformity that is painful with wearing any type of enclosed shoes. It's an inherited thing. Mom, Dad, Grandma, and Grandpa give that to you.
I had one of them surgically removed about 9 years ago. It was a very unpleasant experience, long. The healing time was probably prolonged because of the treatment. So I put off getting my feet fixed.
The mechanics that cause the bunion quite often are associated with the same thing that causes the hammer toes. And there's different degrees of hammer toes. Jeannie came to see me complaining of severe pain. She had had bunion surgery a number of years in the past in a different state. And because of her experience there, she was very reluctant to have this current bunion looked at and taken care of.
My mom and I started looking and researching, and I just decided to pick Dr. Singleton. Liked his personality. He was very clear and concise about the surgery.
Bunion surgery usually involves the cutting of the bone and shifting the cut fragments over to realign the joint, to take the compression forces out of the inside of the joint. If you just take the bump off, that's where bunion surgery has in the past, I think, got a bad reputation. By just taking the bump off, you've done nothing to correct the mechanics that's causing the bump to develop in the first place.
The right foot's healed up really good. The left foot is well on the mend. I can wear my tennis shoes today. My mother and I just, I hit the ground running, and I mean to tell you, as soon as I could get up and walk around, I did.
It's really relatively soon after surgery for her to be doing as well as she's doing right now. She's been a fabulous patient. She's done everything we've told her to do, and that helps so much in a person's recovery after surgery.
So I achieved my goal through this surgery and coming to Dr. Singleton and the surgery that he performed, and I am enjoying pain freedom with my feet, able to do more.
David lost over 100 pounds, and he credits Dr. Carol Norton in helping him lose the weight in a non-surgical way. To find out more about David's story and other life-changing stories, log on to bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Growing up, horses were a big part of my life. I rode every day, several horses a day, and competed through high school. The main problem I was having in my low back was that the discs were degenerating, and I was told it was common in 60-year-olds, not in 30-year-olds. I had some tears that were leaking fluid and was having pain and discomfort down my legs that was keeping it where I couldn't sleep and was just in chronic pain. Did therapy for my back, but still had issues. Slowly things started to go, like riding the bicycles or certain chores around the house.
I generally tell people that surgery is the last thing that we want to do. If the pain is so severe that it starts to interfere with your life, your hobby, your friends, your work, then it might be something that you should consider. If you're in that situation where you have to come home and spend your life dealing with the pain, then surgery is probably something that's a consideration if you failed all the other conservative treatments.
Being that I live in Kansas City, I was from the Dallas-Fort Worth area, I had seen a few doctors in Kansas City and not really gotten any definitive way to get relief. After seeing the Best Docs episodes and watching Dr. Myles, I decided that he would be a good person to contact, and he was willing to look at my information and tell me if he saw anything. And he did see several things that my doctor in Kansas City did not see.
Generally with the surgery process, our goal is to decrease your pain, and our main goal is to get rid of your pain. So that's what we're trying to do when we offer you the surgery, is to get you back to living your life the way you were beforehand with pain freedom.
When I heard other patients talk about achieving pain freedom and that was Dr. Myles' goal, it sounded like a nice idea, but I didn't really think it was possible for me. It's been 3 months since the procedure, and I feel better than I can remember feeling. I thought I would be able to return to riding in January, but now he has told me I can move that up to next month. I'm very excited what he's been able to give me, and really have given me what he promised, which was pain freedom.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
For a little over 10 years after I had a severe case of shingles, it was in my face and in my scalp, I was still having a lot of pain.
Shingles pain or post-herpetic neuralgia is a very painful condition. Humans are exposed to the chickenpox virus at an early stage in life. Sometimes the virus stays dormant in the nervous system and reactivates itself at a later stage. When that happens, people end up with shingles.
Sometimes, if it's severe enough, I have injections. It's been the best experience because he gives me the medication that takes the edge off, and hopefully at some point in time he says it's possible that the pain will go away.
Shingles pain or post-herpetic neuralgia is a very tough disease to treat, but it does not preclude us from helping patients to achieve pain freedom and control their pain as much as we can.
From just meeting him first time, it did not bother me at all. It never bothers me when I come in for an injection.
And I've been seeing her right now for almost a decade. Her pain has been maintained on the medication. On and off, on average, maybe once a year or so, her pain will flare up, and we'll go back and repeat the nerve block on Sandra, and she'll get better for a while. And so far, she's been doing okay.
He's really somebody who is easy to listen to. He's easy to let him administer the pain medication, do the injections, whatever's necessary there.
It's very important to be compassionate, listen to the patient, see the problem they have, and try to control their pain as much as possible. Nerve pain generally is very difficult to treat, and this condition can linger for months or years before it gets better. The disease will get better over time, but takes a long, long time before it goes away.
I feel very confident that Dr. Farhat is working to help me have pain freedom.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
In this week's Best Docs Network special report, we take an up-close look at the LifeWorks Group. They help individuals with their mental health.
I have a 4-year-old daughter who me and her mom went through a divorce, going on 3 years next month. And I saw some behaviors on my daughter that I didn't see normal. She didn't socialize with kids. We will go to the park, we will go to McDonald's, and she will play in the playground, but then when kids will come, she will say, let's go, you know, or quit playing, just standing there besides me and then say, let's go.
She was having a really hard time in social settings, interacting with anybody besides her dad. She was very shy with even children her age. Any other adults would have a really hard time communicating with them, talking with them, playing with them. And so he was concerned that she was starting to be really withdrawn, and he didn't want that for her.
At first it was like, should I do this or should I not? But once I interviewed with Katie, you know, I kind of felt comfortable that this was the right decision.
What children do is they come in and we have a whole playroom stocked full of toys that have been researched and picked specifically for their therapeutic value. Children come in and they use toys as their words. And so based on the toys that they choose and how they interact with them, how they interact with me as the therapist, really gives me a clue into what they're struggling with at home, at school, and gives me a great idea about how to help them through that.
I had doubts of bringing my daughter, thinking that she was too young. You know, I even asked her a couple of times, are you sure that her age, is she okay? She said, you know what, it's the sooner the better. You'll be surprised how many parents wait until kids are 11, 12, you know, and it's tough on them.
In the first several sessions, she wanted Dad right next to her and really close with her. As we've moved on, her self-confidence and her ego strength really has just been incredible. She's gained a lot of strength through this process.
You know, it's a great, great feeling. Seeing her progress and seeing that she has built confidence in her, it feels really, really good. It's a great satisfaction.
When you get over 50, you start to feel the age catch up on you. I work out and I stay in shape, but even with my gym experience and working out most of my life, I still feeling kind of run down.
He performed a hysterectomy, and we started the hormone replacement therapy because I was having the hot flashes, and I just wanted to feel good. I was feeling tired, you know, run down mostly.
When you're younger, you have a good amount of hormones. What we try to do is we try to assess the hormones of a patient at the age they are and then try to supplement her hormones with hormones to give her the level of hormones that she had when she was younger. We achieve those hormone levels with the use of pellets. These small pellets go inside in the fatty area. You don't even see them. The incision is extremely small.
Numb the area, and they just put a little slit and they put in the number of hormones that you need. They do a blood test first and find out what you lack and what you need, and they put those in there and they put a little Band-Aid on there, and you don't take it off for like 3 days, and it gave me more energy, and I noticed that my nails, you know, are growing now, and I feel like a teenager again too. You know, we work out and ride motorcycles together, and we just, you know, I just feel great.
Libido kind of lags along, you know, and you get the hormones right, and everything starts to work again. It works, you know, very well.
Generally speaking, within 24 to 48 hours, patients start feeling a little better. If they had hot flashes, that tends to go away. Energy level starts to increase on a gradual basis over the next 1 to 2 weeks, and a libido does the same thing. Libido, sexual drive, tends to increase over the next 2 to 4 weeks, such that at the mid, they have the peak of the energy level and libido, and they're just feeling real good.
The thing I like about Dr. True is he practices what he preaches. He also is on the pellet therapy.
He is very personable. He makes you feel very comfortable. He treats you like you're the only patient he has.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that have helped change people's lives.
And of course, for more information on any of the great doctors you see on today's program, the good news is you can head to the website and find out more information on them at bestdocsnetwork.com.
You bet. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.